Hi everyone, I'm Jen, chiropractor with Strengthnu, your fitness and therapy experts. And today we're going to be talking about extremity adjusting, specifically the foot and the ankle. Most people believe that chiropractors only treat conditions of the spine, and while that is mostly true, we do treat a lot of spine, so low back, neck, and shoulders. We also can treat extremities, so we adjust ankles, feet, wrists as well. The ankle adjustment is great for athletes who play high impact sports such as basketball, gymnastics, or any kind of repetitive jumping motion. It's also great for those gym goers who like to do a lot of plyometrics when they're training, so a lot of high impact on the feet. However, this adjustment is also great for people who've had chronic sprain injuries to the ankle, so repetitive sprains that just tend to not heal, and you're still experiencing that pain or lack of range of motion in the joint. When you come in for an assessment and you have ankle pain, chiropractors will usually do a gait analysis. So we'll get you to walk, we'll see how your feet are hitting the ground. We'll also look at all different angles, look at your arch of your foot, and the range of motion, of course, as well. So what we usually find is restriction within the dorsiflexion range, which is when you bring your toes up as high as you can towards the ceiling. We'll find a restriction within that motion, and that's where we know that we're going to be adjusting the ankle mortise joint. So the ankle mortise is where the tibia and the fibula, so the shin bone and the smaller bone out to the outside of the leg, come down and meet right at the talus bone. So that's right at the ankle joint, and we call it the ankle mortise joint. A common complaint that we hear from patients is that while going up the stairs, they find that their ankles jam and that they can't get that range to lift their toe up over the step to continue on. So that's a common indication of that you could need this ankle adjustment. Treatment for this is usually painless. You'll hear a little pop while we do the adjustment, but not associated with pain at all. And immediately, most times, people do find a great increase in their mobility in their ankle. Although you may feel increased mobility after one adjustment, if you're a high-level athlete and you have sprained your ankle before, those ligaments are a little bit more lax, so you have laxity within the joint, and over time doing your sport over and over again, that joint can again become misaligned. So preventative care is always better, so come back in for another treatment just to keep everything aligned. If you're recovering from an ankle sprain and find that your range of motion is still not fully there, the ankle adjustment could be your solution to that problem. If you have any other questions, come in to Strengthnu. I'm Jen, chiropractor at Strengthnu, and remember, you're only one strategy away from crushing your fitness goals.